everybody. I'm Vicki Liviakis. Welcome to Body Beautiful. This is the show where we chit-chat with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air. With us today, we have a plastic surgeon, Dr. Elizabeth Lee. She'll be followed by oral and maxillofacial surgeon, Dr. Casey Shamane. And later, we'll be taking your calls, answering any questions you have about either plastic surgery or dental implants. Here's the phone number, 800-440-4884. We'll also be posting the numbers to the guest office, so be ready to jot those down. And before we get started, any advice we give you today, certainly you're going to also want a second opinion. Welcome back to the program, Dr. Lee.
Thank you.
Always great to have you back.
It's fun to be here.
All right, we've talked about great lips. We've talked about all kinds of parts of the body today. We're talking about breasts, a very popular topic.
Yep.
Breasts, sometimes, you know, when they're perfect and there's not a problem, and then at other times, well, especially after having a child,
exactly.
your body changes.
Life changes us. So
and gravity.
And gravity, but that's part of life. So unless you spend your time hanging upside down, things are going to descend. So what we do when we're doing breast surgery is, in a lot of cases, helping to restore what used to be there, and in other cases we're helping to give patients what they've never had. So I look at breast surgery very often as being a reconstructive kind of thing, to make people feel like they're whole again. Now,
tell me and I probably know the answer to this, but augmentation, is that the most popular breast surgery around?
It's the most popular breast surgery nationwide, but in my location, because I'm in Berkeley, it's not the most popular procedure that I'm doing.
And what is that?
Then I'm doing breast lifts and breast reductions.
Okay, and that would normally come from breast lifts, let's say after you've had a few children, nursing,
yes,
the tissue.
And sometimes what happens after you've had children is that the breast tissue changes. You've been stretched out because you were larger when you were nursing, and things are not as perky as they were. And everybody feels differently about different parts of their bodies. But if you really, really were proud of something and you don't have it anymore, sometimes it's nice to be able to get it back.
Well, we idolize breasts. I mean, this is, you know, in this culture.
In a lot of cultures, actually, but we in America like larger breasts.
Okay, and that it was a sort of a curious thing. Why would anyone want a breast reduction if everybody else is going the other direction and going larger?
I often wonder if I got all my breast reduction patients in the room with the breast augmentation patients preoperatively, if anybody would ever talk the other side out of doing what they were doing. But very large breasts are actually something that causes a great deal of physical discomfort. And so not only do you have all this extra weight that's hanging on your back, but you can have changes in the skin and irritation in the skin underneath the breasts. And for women who have been very, very large-breasted, sometimes breast reduction is the best thing they could have done for themselves.
Now, there is a difference in the surgeries, and we're going to be talking about that. Breast reduction is a major surgery, is it not?
Yes, any surgery is a major surgery. But breast reduction often involves large scars on the breast, which I must say breast reduction patients never seem to mind, because it's such a relief to not be burdened with 3 extra pounds hanging off your chest all the time. But when we talk about breast lift patients, they're in a completely different class, where they're really very concerned about scarring. And so we can talk a little bit about what we would do differently and what I'm trying to do differently to minimize scarring.
Okay, and is there some scarring with breast implants as well, or no?
Yes, anytime we cut, there's a scar. The question is where the scar is and how well it's camouflaged. Okay,
part of what we like to do here is to talk about minimal kinds of procedures. Is there something that can be done that doesn't involve surgery here to make a difference in the breast?
For breasts? Not really. There are things that are out there that are kind of negative pressure pumps that plump up the breasts, and they're advertised on the internet. If you look at breast enlargement, you'll get...
Do they really work?
Yeah, no.
Okay.
Not permanently, should we say.
We're going to talk about that, plus we also have some photographs. We'll be taking your phone calls. We need to take a quick break here, but for